Hey guys, Ralph Havens here of Beyond Limits Physical Therapy in Bellingham, Washington, in Fairhaven. And today's video is some very simple things you can do if you're an office worker, if you're on the computer a lot, to help improve your health, improve your posture, improve how you feel, and take away some pain. So give it a try. And I'm going to do it in standing first, and then also in sitting, and show you a really nice technique that also helps with your walking. So here it is. What you can do, and I love this, is always to test and then retest, because we want to see, did we make a difference? Is something different because of what we did here? So I encourage you to pause the video, walk around a little bit, see how you feel, and then come on back. So now here's the technique. The first one is a technique from yoga, and I put the right hand and then put the left thumb right there on the right hand. And then squeeze that hand, that thumb gently, and then take your other hand and put it around your knuckles. So you've got your knuckles there, not those knuckles, but these knuckles, and then you got your finger right here. If you can't do it, then that's okay. There's going to be other ones too. And then what you do is you put this right by your heart. So you can see this kind of looks like a heart. And we're going to squeeze the right hand and then squeeze the left hand. And you're going to do this at a rate kind of similar to a heartbeat, just like this. So squeeze, and squeeze, and squeeze, and then squeeze. And as you do this, a lot of wonderful stuff happens. I've done this for minutes at a time, even longer than just a few minutes. And what I notice is my hips are looser, and my back feels better, and my walking is better, and the drills we do before we run are better. So you want to test it for yourself so that you have a reality that, yeah, this works, and it's worth doing. So that's one thing that you can do. You just take a break from your sitting and do this little exercise. And if you like, you can go ahead and pause the recording and walk around, even right now, and notice what's different. See what's different for you even right now. It might be subtle, or you might notice a big shift. And we're going to layer upon this more things to do. Okay, the next one is real simple, and you put your fingers very lightly on the top of your sternum, the top of your breastbone, right here. And then your other fingers right on your belly button, super light. And if you were going to touch a butterfly, you would want to touch it very, very, very lightly so you don't hurt it. You don't even want to bend the butterfly's knees. And that's the amount of pressure we're going to go right here. So, got a little dot there, just right on my spot. So you touch those spots, and you touch it very lightly, and then you push the skin up this way, towards the top of your head. But you do it super light. If you did it to somebody else, they wouldn't think you were touching them hardly at all. Now just doing this will start to get into a very deep meditative state, and it can take pain away, it can make you feel better, make you feel happier. It's quite an interesting technique. It's an old chiropractic technique. Yeah, and then what you can also do, either sitting or standing, is turn a little bit to the left, and as you turn to the left, then turn your eyes back to the right. And then relax, and turn a little bit more to the left, and turn your eyes to the right, and relax. And turn a little bit more to the left, and turn your eyes to the right, and relax. And then come back around and turn to the right side, and turn your eyes to the left, and relax. And turn a little more, and turn your eyes to the left, and relax. And turn a little more, and turn your eyes to the left, and relax. And now go ahead and walk around again. Hit pause and walk around again, and notice what you notice. Notice if you're feeling a little lighter, a little different. And you can do this sitting or standing. I'll show you both ways. Now the next one is something that helps with walking, helps with a lot of stuff. There's a little muscle right here at the back of your head, between your head and the first bone in your neck. So it's right there. And what we're going to do is touch that area with 2 fingers. So I use the middle finger and the thumb, and I just touch like this. And again, you're going to touch super light, like you're touching a butterfly, and you're going to push the skin up that way, just a little, but just a little. And then the other hand goes here, and just a little, and just touch it. And if you did this for 15 seconds or 30 seconds or a minute or more, and then test your walking, you'll feel different. You'll feel lighter. We call this the rocker technique because when I did it to my little boy, my little track star boy, he noticed that he could move better. There's shoes that kind of rock you forward, and they're called super shoes, and he felt like he had some super shoes on. He said, wow, I got my rocker back. So we call it the rocker technique. It helps with running, it helps with walking, it helps with a lot of stuff. And it works on an area in your upper neck that is a part of the vagus nerve. So it helps with stress and trauma and the digestive organs and the heart and lungs. It does a lot of good stuff. Okay, and then the next thing I want to show, one more thing, and then we'll do some in sitting, is a little technique that we use. I think I can show you here. I think I'm going to bring it down a little lower. Let's see. So what you can do is think about as if you have a little button on your heel right here, a little button. And then you have a little line, a little groove on your inner leg right here. And what you're going to do is take that button, you bend your knees a little bit, and you take that button and you let it go up that little groove. And you can tell my foot that's going up is just totally relaxed. I'm not trying to hold it up. I'm not doing this. I'm relaxing everything from my leg, my knee down. My foot is totally soft. So you do this a little bit. This knee is bent a little. With the one that goes up, I'm not out here. I'm not over here. I'm right in line with that little groove. And then you can do the other side. So we got a little button, a little groove. Actually, my button is here, and my little groove is here. And so bend, and then it just goes up. And the foot that goes up is very relaxed. And after you do a few reps of this one, you can walk around and see what's different. Notice what's different with your walking. Notice if your feet feel different. Notice if you feel lighter. I'll give you one more little bit of information for this. That's kind of cool. You can combine these things. You can combine these things. So you could do this one while you do your little heel ups. You could do this one while you do your little heel ups. And you could do the belly button and the top of the sternum while you do your little heel ups. So now go ahead and hit pause, walk around, and see what's different. And just to show you this situation, you can do it in sitting. And I'll tell you why I have a towel here. So you could do the same thing in sitting. You could hold your fingers on your belly button and your top of your sternum and turn and bring your eyes to the other side. You could do it to the other side. You could do this one. And what was the other one I showed you? Oh, and you could do this one. The right hand, the thumb, the knuckles. Squeeze the right hand, squeeze the left hand. So it's a little routine that you can use if, maybe when you get to work, middle of the morning, when you get back from work, from lunch, middle of the afternoon, before you go home. Do it as often as you want and start to see how loose and limber and light you feel, how healthy and happy you feel, and let me know. Send me a message. Ralph@ralphhavens.com is the email. And one last bit of information. I have a towel here because when we're sitting, it's easy to sit like this and do your computer work. But you can try to sit up straight. You can even try it now. And it takes a little work to sit up straight. But if you do this, you kind of pull your bottom back and you sit on a little towel roll, just barely on a towel roll. Let me get a little better angle of that. Now it's easy to sit up tall. And if I pull that towel roll away, it's hard to sit up tall. But if I put a little towel roll underneath the back of my bottom, I can sit up tall. And now, when I bend, I can bend through here, and you can see my back is not getting torqued. So you can try this out for sitting. This is a bunch of stuff to help you with if you're a sitting worker, and even if you're not. So give it a try. Again, my name is Ralph Havens, Beyond Limits Physical Therapy in Bellingham, Washington, and worldwide via Zoom. So you can reach me at ralphhavens.com. Also my email, ralph@ralphhavens.com. And the number is 360-599-2217. Let's get out there and live. Let's really live. All right, you guys.